Hello, everyone, and thank you for joining us today from around the world for our virtual program focused on combating vaccine hesitancy, today's fight against misinformation online, hosted by Chelsea Clinton and the Clinton Global Initiative University. My name is Maisha Alexander, and I'm the Impact and Design Manager for CGIU. And in my role, I help create content and support structures that help student leaders figure out how to develop their knowledge and skills to implement the social impact projects that they've created in their outstanding efforts to solve some of the biggest challenges in our communities around the world. And I'm really excited and honored to be welcoming you all. Today's virtual program brings together vaccine topic experts for a discussion on vaccine advocacy and how young people can support and promote factual health messaging during the COVID-19 pandemic. Following this discussion, we'll also hear from Steve Chuente, co-founder of AccuraLab, about his work to develop an easy-to-use tool that allows smartphone users to fact-check COVID-19 information that they've received on social media and online. Steve is one of our 38 awardees of CGIU's COVID-19 Student Action Fund, which provides funding to student projects addressing the public health, economics, and societal impacts of novel coronavirus, with commitments ranging from awareness and prevention campaigns to social enterprises, to infectious disease monitoring and response systems, to other emergency response initiatives that are providing immediate support for public health practitioners and our essential workers on the front line. Also, in partnership with GoFundMe, CGIU has just launched the COVID-19 Student Crowdfunding Challenge to give other COVID-19 Student Action Fund finalists another opportunity to compete to raise funds for their commitments. To learn more about these participants and their projects, please go to GoFundMe/C, like the letter C, /CGIU 2020. And now it is my honor to introduce the Vice Chair of the Clinton Foundation, Chelsea Clinton, who works alongside the Foundation's leadership and partners to help create economic opportunity, improve public health, and inspire civic engagement and service across the United States and around the world. In addition to her foundation work, Chelsea is also the author of several books for young readers and teaches at Columbia University's Mellman School of Public Health, and we are absolutely honored to have her moderate our conversation today. Thank you so much. Chelsea?
Oh my gosh. Maisha, thank you for that introduction, and thank you to everyone who's joining us from across the United States and all around the world. I want to thank our three panelists. Maybe as I introduce you, you can wave so the audience knows kind of who you each are. We have Karen Ernst, the Executive Director of Voices for Vaccines with us, Judy Klein, the President of Unity Consortium, United for Adolescent and Young Adult Vaccination, and Amy Pisani, the Executive Director of Vaccinate Your Family. I am so grateful for all of the expertise that you're bringing to this conversation, and even more grateful for all that you and your organizations are doing every day to both combat misinformation about vaccines and vaccination, as well as kind of be strong advocates for good information about vaccines and vaccinations. And while there has been so much attention paid now to the work that scientists are doing to find a vaccine or possibly multiple vaccines against COVID-19, I do think we need to be engaged in a parallel effort, really advocating for people to take those vaccines once they are safe and ready to be given. We know that here in the United States, unfortunately, depending on the survey, somewhere between a third and half of Americans say they are hesitant to take a COVID vaccine. And we know that while the numbers may be kind of uniquely high here, vaccine hesitancy is a challenge across the globe. So I think, a great place to start would be just for each of you to maybe explain why you're each in this work. Kind of why is this so important to each of you? And then hopefully we can talk about kind of what you're already doing and kind of how students can help fight back against vaccine misinformation. So maybe Karen, we'll start with you, and we can kind of go around the screen. So What drew you to be such a pro-vaccine, pro-public health, pro-science advocate?
Thank you so much for having me, Chelsea. This is quite an honor. You know, I was basically an English teacher, high school English teacher, on leave of absence to raise my child while my husband was deployed overseas. And my 10-week-old or 10-day-old baby was exposed to chickenpox at his older brother's preschool. And that's when I met my first person who was vaccine hesitant. And sort of, it really struck me that the vaccines that we take in really do have an effect on the people around us. And I just sort of was drawn in to this world of amazing people and wonderful science and great advocacy, and so happy to be here.
Great. And Judy?
Thanks, Chelsea. And again, it's an honor to be here along with my wonderful colleagues and this fantastic group of students. So I grew up in a family where my father was a family practitioner, and I kind of went more the business route, but came back to healthcare because I really felt passionate about, vaccines and improving coverage. I mean, I feel very strongly that if there is a vaccine available to prevent a disease, then there should be nobody who gets that disease. And I was also spurred by a personal friend who I had, befriended my freshman year in college, and I think it resonates with this group here. Her name was Roseanne, and she was with me on my freshman floor in college. We ended up working together. We were in the same community. She ended up early in her marriage getting cervical cancer. She fought it and was able to have 2 young children with her husband, but sadly it came back. And, that left her husband and her children without a wife, without a mother. And I'll just never forget the devastation on his face and that loss. And it was difficult for him to even go on. So for all those reasons, I'm very passionate that nobody should get a disease that's preventable.
Agreed. Amy?
I'm here.
Oh, Amy, could you just as an opening, explain how you came to this work and why vaccination is so just personally important to you?
Thanks, Chelsea. And I must have had a delay. I was waiting for Judy to finish. Sorry about that. So I've had an interesting road. I was a grad student, actually. I was studying to work with deaf children. I went to school in Washington, D.C., and I went to Gallaudet University for the deaf. And Every Child by Two, which was the name of our organization, came into the American Nurses Association, where I was working while I was getting my grad degree. And I was told, oh, there's this job working with young children. Since you love kids so much, I think you might love it. And I went down and I interviewed, and I got a job at 26 years old, working for former First Lady Rosalind Carter and Betty Bumpers, who is the former First Lady of Arkansas, and her husband was a senator for Arkansas for years. So boy, I was, probably just a little bit older than the folks who are on the call today, and I had this amazing opportunity. And the irony is, I wanted to work with deaf children, but I ended up getting a job, and now I've been in this job for 25 years. There's very few deaf people now because of vaccines. I mean, rubella used to be a major cause of deafness among children. And so it's an irony, and it's been a real privilege for me to be in this role for 25 years. I've traveled to Africa with Betty on several occasions, and I've seen the power of vaccines. I've seen the power of Rotary, which is why I ended up joining my Rotary Club. And it's just been an amazing ride. Things have changed. We fought for years for access for vaccines, and now we're fighting disinformation. So everything's different every day. We get a chance to meet new people. I met Judy and Karen, and just there's so many people out there that are working against this fight against disinformation. So it's been a real honor for me.
And why don't we just plunge right into the fight against disinformation, because the anti-vaccine movement unfortunately has seized on this moment to really grow its reach and its kind of constituent base, and has no pun intended, really kind of been very good at virality, at kind of creating content that does go viral on social media platforms. So could you all just talk, and maybe Karen, we can start with you again, about how you combat misinformation. How do you respond to kind of both things that are totally factually inaccurate and things that are factually incomplete. How do you do that online? And how do you think about the different platforms?
Well, the very first thing I want people on this webinar to hear, and if they take nothing else away, to take this away, that even a simple statement such as, that doesn't sound right, or that doesn't comport with the truth I have, or I don't believe this. Even just that statement, if you do nothing else, can really make a dent in how far misinformation goes from the point where you see it. And so even if that's all that you do, you're doing something. But we're at a big disadvantage here when we've got science on our side, and that's that science has things that people hate. It has nuance, it has numbers, it's confusing, it's big, and no one wants to take that on. It's so much easier to understand a simple, small, easily digestible truth. And so what we really have to look at doing is taking what we have and making it into something that's simple, digestible, people can grab and understand quickly. And so taking a page out of that anti-science handbook really helps us out a lot, that we can create explanations of how clinical trials work, the fact that we're testing a vaccine right now with 20,000 people receiving it and 10,000 people receiving a placebo, or basically a saline injection with nothing in it, and we're comparing them and seeing what the difference is in who gets sick and who doesn't get sick, who has side effects and who doesn't have side effects. And at the end of that, we'll know this vaccine is safe and works, or it doesn't, and that information will be out there. And just that simple piece of information, just giving that to people, sort of helps assuage the idea that it might be unsafe. Well, you'll know. You don't have to know now, you'll know. And so that's really what we're looking at doing at Voices for Vaccines, is helping break that down, keeping it true, keeping the nuance, but making it digestible so people can take in what they need at any given time quickly.
And I think one of the challenges, Karen, which maybe Judy you could speak to, is there are also just some bad actors who are in positions of authority that we also have to confront, right? So how do you think about that, Judy, when it's not just kind of the faceless Twitter account or the kind of faceless Facebook account, but it actually is someone who has a medical degree, who last month was peddling hydroxychloroquine and now is saying maybe secretly they're working on a vaccine too, and it's not in the trials of the in the tens of thousands of numbers that we were just hearing about from Karen. Or when you have Russia saying that they now have a vaccine even though they haven't conducted any large safety or efficacy trials. So how do you think about that challenge when you have kind of people who have medical degrees who are still engaging in kind of fake science, and when you have kind of people in government positions whose first and most important job should be to protect public health, and they're taking actions that are contra to that? How do you navigate that?
It's a great question, but there's some good news. We know that people listen first. Who do they trust the most, and who is their biggest influencer? We know from surveys and research that it's their healthcare provider and it's their community leaders. So they hear all of these things, Chelsea, coming from the leaders you're talking about, and coming from social media and coming from friends. But when they are asked who do they trust and who influences the most, it's their healthcare provider. So what we need to do, in my opinion, and I'm not alone, is to really enable and empower healthcare providers to be strong advocates and be comfortable and confident giving strong recommendations to the vaccine to the people that they serve. And I think that strategy, will work because it is based on research. And as you say, Facts alone do not motivate people to take action and to not believe those anti-vax views. It has to be facts plus things that emotionally resonate with them and that they, can really adopt and see themselves in.
And Amy, maybe you could just kind of follow on what Judy was saying, like how has the dynamic that we have of not only kind of in this country, but again, kind of in Russia and elsewhere, when you have leaders who you hope would be kind of guided by science, rooted in a kind of public health paradigm, always, but especially now, when we have leaders who instead are kind of pushing hydroxychloroquine or instead are pushing kind of a vaccine that hasn't been proven to be safe or effective, does that make your job harder, Amy, to then kind of be a strong advocate kind of for safe and effective vaccinations on one side, but also then people taking those vaccinations, ensuring that they are taking their children to get vaccinated?
Right. I mean, especially with COVID. I mean, we've been already dealing with people being afraid to go to the doctor's offices during the COVID quarantine. And so the whole vaccine community and all the medical community are working to get kids back in. We're seeing an uptick in young children, but we have a real issue with adolescents, and that's pretty scary. For me, obviously, I have adolescents. I have a 15-year-old and I have a 19-year-old, and they've been vaccinated against HPV and all the other diseases. But so on that realm, yeah, we have a double challenge. First of all, we're in the middle of a major quarantine. Adults aren't getting vaccinated either. So we're seeing another generation that could be susceptible, like with if they get pneumonia or flu, we have to get everyone back in. But when we look back on where the message is coming from, right, Chelsea? And that is really the key. In past epidemics, we've had the leaders of CDC. They were constantly the group that, we were seeing them on TV every day. We'd see Richard Besser, we'd see, we would see Jeffrey Copeland, others, up to the plate. We're not seeing that now, and it's not that I'm polarized in political view, but no matter who's in office, if you're not of that party, you're not going to trust who's speaking. And so whether it's a Republican in office or a Democrat or whoever is in front of the camera, they have to understand that they're a political figure, and they really should be deferring to the medical experts out there so that everyone will trust what's happening and will follow the guidance of those leaders throughout at both the national, the global, and the local level.
I think, Amy, that's a painfully good segue into now some of the questions that were submitted beforehand, including a question from someone who asked about the understandable lack of trust among some people in the United States because of their either current or historic experiences with the medical community. Kind of the question was framed in terms of the Tuskegee syphilis experiment, which lasted until the 1970s, where the U.S. kind of public health agency conducted an experiment on African-American men who had syphilis, actively denying them treatment that could have saved their lives, literally. And yet we know this question isn't only relevant to Black Americans, it's also relevant to Indigenous Americans, kind of First Nations Americans, Native Americans, who have been betrayed over many generations by the Indian Health Service. It's relevant to some women who have also kind of not received the care that kind of they deserved at various points throughout American history. So kind of what do each of you say, and Karen, maybe we'll start with you again, to people who have actually really valid reasons for being skeptical, even suspicious about kind of the medical community and the public health community, maybe because of an experience they had, maybe an experience that their parents or their grandparents had.
Sure. My family is an interracial family. And so I have family members who are hesitant about the flu shot and hepatitis B vaccine and the upcoming COVID vaccine because they are Black people who have not been given the health care that they need. And that's a huge topic and it needs addressing. But for me personally, hearing people out and listening and really taking in what they're saying to me has been very key and very important. And I have noticed a shift in my family, but also in the broader community, as far as, hey, COVID is hitting our Indigenous neighbors, our Black and brown neighbors, harder than it's hitting white middle class people. And so they are now taking a look afresh at a vaccine. But you know, I always say to people, I'm a real nice white lady, but what I really want to do is make space for the people who are experts in the field, who are Black, brown, and Indigenous, to come out and explain to their people who look like them, the people who live in the same communities as them, why they do trust vaccines. And I think that really making space for those messengers is vitally, crucially important. And sort of goes back to what Amy was saying about trusting the experts, but also trusting a wide diversity of experts and elevating those experts wherever we can.
I had to unmute myself. I think, because we only have a few minutes left, and I want to try to get to as many audience questions as possible. I think the next question is also a really important one, which is, like, what messaging hasn't worked? So what messaging should students avoid when they're talking to kind of their family, their friends, in trying to help build vaccine confidence? So what shouldn't people say? Because you found it hasn't worked. And I don't know who wants to, maybe Judy or Amy, if you want to weigh in.
Well, we found that Judy, you're on mute, so I'm going to grab out here, and I'll be short. Over the years, there's a lot of different research, and I would really encourage students to, to try to talk to their professors and, ensure there's vaccine curriculum in your schools, because, different research shows you have to speak differently to different audiences. If a person comes in and and Karen has a lot of information on this as well, if they come in and they're a little bit skeptic, it's a totally different conversation than you're going to have with someone who's completely opposed to vaccinations. And so there's different flows of conversation that you would have with those folks. I literally had dinner just 2 nights ago, well, distant dinner, with a woman who asked me whether or not she should get her kids their HPV vaccine. Now, they should have already gotten vaccinated. I had a really simple, brief conversation with her and told her, I already got my kids vaccinated, both my boys. It's not just for girls. And I just talked about, I said the HPV vaccine is the safest vaccine that is on the market. It has the longest safety record. It's an amazing vaccine. And if you don't vaccinate your kids against that, they could get oropharyngeal cancers, cervical cancers. So it's always different. And the key now, and I just want to mention one other thing, the National Academy of Medicines and the CDC's Advisory Committee on Immunization Practices, they're looking at the prioritization of vaccine for those really high-risk groups for COVID. And the most important thing that they're doing is talking about what are the community's needs, like those communities that are at highest risk. How do we communicate to them? Because you don't just want to do a national campaign and say everybody in South Dakota is going to listen to the same thing they're going to listen to in Detroit. So it's about personalization and getting funds from the federal government to the local communities so that they can be a part of it. And I would say students have the biggest role here that you can imagine. They're the ones who are in touch.
I totally agree. We all have to start with our own families and our own communities. I think we also have to really care about the equity, not only here in the United States, but really globally, and of who will be able to access vaccines. And I should just go on the record, like, I strongly believe we should vaccinate our frontline globally, and high-risk populations globally before those of us that are not high risk even stand in line. So here's a question. We've just finished building our first medical clinic in Awel East, South Sudan, and are planning opening it in February of 2021. How will a smaller and under-resourced clinic like ours be able to gain access to the vaccine when it becomes available and we know it's safe? What advice would you have for that?
Work closely with the WHO. They have amazing resources there. Obviously, our country is not funding the WHO, but that doesn't mean we're not all still working with them. They have, we've done a lot of one-on-one work groups with them, and it shows that a lot of developing nations, they don't have a good website. Their government doesn't have a good website for vaccines. And so one of the biggest things you could do is try to create a website that becomes the source for your nation. And then of course, you're in an immediate issue here, but that's my recommendation. WHO is your best shot.
I agree. And we should all be supporting WHO, including in their kind of really critical work fighting against vaccine misinformation and kind of fighting for kind of better public health messaging globally. The final question, one that I care a lot about in this broader conversation, is what role do each of you think the social media platforms, such as Facebook, have in fact-checking vaccine misinformation, and how do you think they're doing on checking vaccine misinformation? And so maybe we can, Karen, start with you, and then we can kind of go to Judy and Amy too.
Perfect. I give them an F. Just right off the bat, they're not doing great. And a lot of it is that they have all sorts of algorithms to figure out whose information they want you to see first. And so if you are a person who is prone to conspiratorial thinking, you're just going to get more and more and more of that. And part of that is because they want people engaging on their platforms, and they don't want to challenge you, because if they challenge you, you might disengage. And so they aren't really looking out for our best interests, which is not surprising. But we really should push them to do better on that, even though their first instinct is to do worse, because it's not just, my Facebook group and the peace and quiet in there that's at stake, but it's really global public health. And so we really need to push back. We need definitely to contact our lawmakers, some of whom have been very brave on this front in pushing back against social media platforms. And we need to push them to deplatform certain bad actors, such as YouTube, who just deplatformed Del Bigtree. We need more of that.
Yep, amen. Judy, do you want to add anything to that, or any kind of final thoughts you want to share?
Sure, I agree. Obviously, what Karen just said, and Facebook is the primary disseminator of misinformation when it comes to the anti-vaccine. And I would just say we continue to learn. And we had recently some researchers from George Washington University present their findings from a paper published in Nature, the online competition between pro and anti-vaccination views. And spoiler alert, we're not winning. And
we're losing. Not only are we not winning, we're losing massively.
We're losing. And in current trajectory, the anti-vaccine voices will continue. So, but what we learn from that is how to kind of take on successful strategies. And those strategies include working with community organizations, customizing our messages to meet their interests, and making sure those messages are not just fact-based, but also emotionally resonant. And then advocating, as Amy and Karen just mentioned, advocating with Facebook and other social media platforms to shut down false and misleading information. So those are a couple things I would recommend.
And Amy, anything you want to add?
I just want to give it a positive spin. I think there's an amazing group of people out there. I think I met Karen on Facebook. There's an army of people who are trying to counter disinformation, and they are up every moment of the day and night around the globe. And I would say that everybody, that Karen and Judy both said it correctly, we need to break out of our echo chamber. We have a huge following, for instance, on Vaccinate Your Family's Facebook page. We started back in 2007. So we have almost 200,000 folks. And it's amazing how many people are engaged. But we have to get out of that chamber. And again, for the students that are on this site, we have to get to school groups. We need to get to all the groups that you talk to. And that includes, we have Instagram, and we all have YouTube pages. So anything you can do to help us share the factual information would be amazing. One thing I would really encourage, Vaccinate Your Family has a series of personal videos of people whose families have been affected by preventable diseases. Some have lost loved ones, some have long-term disabilities, etc. So share those videos. I mean, that's kind of the messaging that we know gets to people. And if we can get them to understand the dangers of diseases, then we can then talk to them about why they want to get vaccinated against them.
Yes. I mean, I think that is such an optimistic note to end on, Amy, of like what we can do, you know, in real life and also kind of online. I also, though, really want to underscore the previous grade, though, of giving Facebook an F, because I think we have to be able to hold both of those kind of thoughts simultaneously, kind of on a personal level, continue to do whatever we can, while also kind of work to change the structural dynamics that kind of have led to kind of the increasing virality of the anti-vaccine and anti-science, anti-public health kind of information, because I think we have to be able to do both simultaneously, and we need the platforms to take more responsibility. And I also just would say, you know, if Facebook is smart enough to figure out algorithms that kind of, you know, for many years prevented any sign of a nipple, including if you were breastfeeding a baby, like they are smart enough to figure out how to prevent kind of anti-vaccine information from kind of lasting on the platform for more than a second. Like, it's not rocket science. And so clearly it is a conscious choice that they continue to make every day to endanger lives around the world. And so while all that you're doing is so vitally important, I think we also have to continue to call out Facebook. And I think Judy wants to say one more thing.
I just want to say to the group that you've gathered that they are vitally important, because we know from a recent study from the Korean CDC that the age group of your fantastic students are the ones who are most likely to bring COVID-19 home to their families. So by them vaccinating themselves and sharing that with their networks, you guys can be a big change. So I just wanted to, Chelsea, mention why it's so important for these guys to be engaged.
Absolutely. Well, I just want to thank Karen and Judy and Amy. You know, I hope you'll join me virtually, I guess, in giving them just a round of applause for kind of everything that they all shared today, but even more for all of the work that you're doing really around the clock with your teams and kind of with kind of your network globally to fight against vaccine misinformation and to fight kind of for vaccines. And we're incredibly, incredibly grateful. And I'm also incredibly grateful to now be joined by our next guest, who you heard Maisha talk about kind of at the beginning. And I hope, oh, there Steve is. I can see him. Hopefully you
Hi,
can
Chelsea. Yes, can you hear me?
Yes, I can hear you perfectly. You know, we're just, Steve, so excited for all that you're doing to help fight vaccine misinformation. And I think, why don't we start kind of with the same question I started with for the panelists? Kind of what drew you to this issue now?
Okay. First of all, it's really an honor to be here and to meet you, Chelsea. So actually just started through a hackathon. I'm a grad student at HEC Paris, and I remember when the pandemic started in Africa, I started receiving a lot of fake news on WhatsApp, mainly coming from my family, and they were sharing it because actually they were caring. Exactly, from a family, and they were actually sharing it because they were caring, because actually they were really caring about where I was and what I was doing as well to protect myself against the COVID. So I was just feeling.
Did you see when you got it, like when you opened WhatsApp? Did you know, like, you're like, oh my gosh, like, this is my.
Yeah, I think for some of them, I definitely knew. Like, for example, one of them was actually, and the one that actually struck me was one coming with one logo of the UNICEF. So it was definitely a wrong message. And that message was saying that whenever you live, if you live in a country where the temperature is above 25 degrees Celsius, you can get the COVID-19, and it was just not possible. So when I saw those kind of fake news, and it was just a few hours later, I remember I just had one of my friends at the MBA who taught me about that hackathon organized by the MIT, and the goal of the hackathon was actually to combat misinformation. So I signed up, I met two incredible other people at Hackathon, and they were living, one was actually coming from Morocco and living in the US, in New York, and the other one was living in Texas, and she was coming from Ghana. And we never met before, but we all had the same finding, which was that misinformation about COVID-19 is growing and growing fast, especially on social media, for example, as WhatsApp. And that's where everything started.
And so talk a little bit about like what you and your team have designed.
Definitely. So actually, I think Karen and Judy, they really mentioned it, and I was really happy to understand, to listen to them speaking about, is really about how you put health information in a very understandable way and make it available to people on the ground. So Africa is very specific in terms of behaviors of the people living there. And our goal was actually to just position ourselves as an entity between those trusted health organizations such as the CDC, the WHO, but also the Nigerian CDC and other local organizations, and the user on the ground who are actually smartphone user. And actually what we are doing is we are just taking the articles published by those trusted health organizations and putting them in very simple to understand, easy to use nuggets of content that we then make available through WhatsApp to those users. And that's how actually we help them to get informed about the COVID-19 by fact checking actually some of the content they can see, for example, on the social media. But also at the same time, our goal is to try to raise the awareness towards the danger of misinformation. So for example, by sending to our users sometimes some tips about what are the key five moves you need to do when, for example, you receive information on WhatsApp that you consider to be wrong. Don't just share it. First, think about it critically and maybe fact check it.
So have you used this with your family? I mean, since we started the conversation with you saying kind of you first were aware that there was misinformation because of what you were receiving. Now, have you done this with your family? Is it working?
Oh, definitely. Yeah, definitely. Actually, I have to confess that my mom was one of my first beta tester for the system we put in place, and she's in Cameroon. I think she's watching us now.
What's your mom? What's your mom's name?
Filote.
Hi, Filote. Nice to meet you. Thanks for joining us.
Thank you, Chelsea. So yeah, that's exactly what we were doing. Meaning, we started with the first beta testing with not a lot of users, around 30 users around different countries of Africa, but also in Europe and the US. And we really tried to scale up quickly. So for example, last week, we had a new partnership with Ghana, with HEC University. And as Karen and Judy were mentioning, having the student at the heart of the fight against the misinformation. So we're actually working with a group of amazing students at HEC. And what they're doing is, since already 5 days, they have been able to open the service to more than 300 people on the ground who are actually using the system in order to fact check some information. And they receive in return some very simple messages coming from articles from WHO, the CDC, etc.
So Steve, for everyone watching here, especially, students who are at universities, across the continent, they start using your service to fact check. How do people directly engage kind of with what you're doing to kind of be kind of pro public health, pro vaccine kind of advocates in their own families, in their own communities, but also at their local universities?
Definitely. So I think I would just take back the two keywords that Georgie, Karen, and Amy mentioned. It's all about fact and emotion. The way actually you make people come back to facts and to easily understandable fact about health. And we know that it could be very complicated sometimes to kind of get into those articles of those trusted health organizations and understand exactly what they are about. So that's the first thing, making the fact available to them and making the information in a very simple format to be understandable by whoever will be reading that format on the field. The second thing is really emotion. I mean, I'm really convinced that by identifying yourself to your target audience is really a key way to be sure that they will be able to understand actually the value, but also the potential impact they could have in this fight against the misinformation. And that's really something we're trying to do at CureApp. We're actually targeting that's something we'll be doing in the next coming weeks, targeting some very remote community who, for example, don't even have access to smartphone user, but we want actually to smartphone, but we want them them actually to also receive this information, for example, through just SSD messages, because those people are also facing the pandemic. They're also living with the COVID-19. They are all experiencing the new normals. And the way you identify yourself to them, and the way also you put your messages in the format, for example, by talking the local languages, that could be a very quick win to do in order to make those people actually bound and engage with you. And the last thing I could say about that is the infodemic has been something very fascinating, because we saw that from the beginning of the pandemic to now, the infodemic has been evolving as the pandemic was moving. At the beginning of the pandemic, the majority of fake news was around what is the COVID, where is it coming from, what caused it. But right now we're actually seeing that a lot of hesitancy is coming around the vaccine topic. And that also means that we have to be able to understand what are the key problems or what are the key questions that people are having on the ground. Because by actually being aware of that, you can provide them with fact check and easily understandable information to make them take the best and wise decision.
And Steve, what are you finding you're having to fact check most frequently? Or what are the questions that you're getting? Even in the last week, you said you now have 300 students signed up with University in Ghana. Like what are you what's your real-time look at like the fake news that is gaining traction right now, unfortunately?
Yeah, exactly. So we do have a lot of fake news around the statistics. Like, for example, how many people are experiencing the COVID-19 in a given area. We have, unfortunately, a lot of people on the ground who are not aware of those multiple API we have online that actually track the number of cases per country. And that's really something we're trying to address as well. Like, for example, when someone on the platform just mentioned, let's say, Ghana or Cameroon, we come back to that person in a few seconds with the latest statistic from the NCDC. So we have a lot of questions about statistics. We are also seeing more and more questions about the vaccine. And people are actually quite afraid about the vaccine. They are wondering, is it really something? How effective it is? They are asking themselves, what are the side effects if I decide, for example, to take the vaccine when it will be validated? And what I can see a lot is the majority of those questions, we are having them because people actually don't know. They are not aware of what are the different steps of the protocol we have to follow in order to consider a vaccine to be safe. They are not aware of what is the current rate of efficiency of, for example, of a given vaccine, which is under development. And that lack of information, I believe, is really a building block of the misinformation and that hesitancy we are much more seeing around the vaccine of COVID-19.
Steve, one of the things that really struck me in the conversation, with Karen, Amy, and Judy was the suggestion that we needed vaccine curriculum in school, right? We do need to be teaching in science class at whatever kind of the right age is, or maybe kind of at multiple grade levels. But here is what a vaccine is. Here's how it helps trigger, and build an immune response. And also, like, here's all the science and the safety testing that went in to ensure kind of that this vaccine would work and wouldn't have kind of scary or negative side effects to build that immune response. And probably the curriculum for a 10-year-old is different than a 17-year-old. But that was said, and I just thought, yes, like we do need that. Because I'm also curious, like, what are you hearing kind of different questions from kind of different generations, right? Is the question your mom asking different than the questions you're hearing from local students that are different from maybe like any kids in your lives? Like, how do you kind of think about kind of the generational dynamics, if they exist at all here?
I think it definitely exists, and that's a very good point. The infodemic, as the infodemic is moving and evolving with the pandemic, we don't have the same pattern depending also depending on the age range of the people who actually are spreading information around social medias. For example, people around a given age, maybe teenager, they'll be much more wondering about what are the measures I have to take in order to protect myself. But people maybe on the later age will be having very, very strong position about maybe it's not really relevant, or it doesn't make sense for me to take the vaccine. So we do have to share those very specificities among the different profiles we are facing. And if there's also something we're quite convinced about is having both a direct and indirect communication strategy, meaning directly targeting user of smartphone, because we believe that those people, they have access actually to a lot of social media. So at the same time that they can spread very easily information, they can also get access to information as the condition that the information is really well put for them to be understood. So those people actually can as well act as like an intermediary to older generation or old people who don't have actually access to smartphone. And for example, by actually opening the service to some student, then they can go back home and maybe talk about, you know what, actually I heard about this very simple WhatsApp channel called App, and that actually helped me to fact check some information. And that's how they can actually also share those very factual news to the people around them, to the family, but also to friends.
Yeah, I think that's so important and makes so much sense. I mean, I love how WHO is really trying to kind of up its graphics game and kind of have more, not only easily digestible, but also more easily shareable kind of bits of real information and that can be shared on multiple channels. And I have such enormous respect for the African CDC, and think, you know, for such a still relatively new organization, they have been just extraordinary. And you mentioned the Nigerian CDC, which also I think is a strong public health leader globally. Have you found like some of the kind of groups that you're working at, you're looking to as being kind of the authorities that will be recognized hopefully in communities? Like, who is doing a better job, do you think, in helping kind of speak in language, in terms that are still 100% like public health and science based, but are like understandable if like you don't have a degree in biology or you don't have a degree in public health?
Yeah, unfortunately, maybe my answer will be biased, but that's just what I. That's just I mean, that's just what I saw. Unfortunately, when I look around what is going on in Africa, I haven't seen a lot of organizations that actually taking the lead to communicate much more locally and targeting very specifically actually different population. We do have a lot of local initiative from health organization and governmental. That's good, and I think that's a good start. But at the same time, how can we guarantee that actually the people we are sending that information, they are really bounding or engaging with them? I think right now, I'm not sure there's any follow-up. I can't see it so far. And for example, and I think the WHO has amazing initiative in terms of a chatbot that was actually giving a lot of information about the COVID. But unfortunately, when, for example, I shared the chatbot with some of my friends, they were like, yeah, but actually I receive a lot of information when I send a single question. So I'm not going to go through all of that. So unfortunately, that's the fact. That's how people on the field are reacting. And if really you want to be able to engage with them, you need to understand first how you need to communicate with them. So just listen to them and listen to how as well you need to put those messages. What is the right media to do so? And for me, that's only the way you'll be able to engage with them. And we are very early stage venture, and we know that we still have a lot of things to do. But at least what is very key for us is to be sure that we target a community, we make sure we bond with them, we engage with them, and from there we follow them as they move towards the pandemic and the infodemic.
Well, I certainly hope that if there are any kind of anyone from the African CDC or kind of any of the local country CDCs listening, that they will reach out to you, because clearly
I would love that.
What you're doing is so important. We got some questions from students beforehand, so I just want to use our last few minutes to kind of ask those, if that's okay. So here's the first question for you, Steve. Steve is very industrious, clearly, and has proven to kind of be working on something that can have a real long-term impact. What keeps him going without losing momentum?
What keeps me going is probably curiosity and the fact that I really want to have to kind of aim that social impact. I know that I'm just one person from Africa among billion of people, and a lot of other people actually facing the same issue that I'm facing. And if I have the resources right now to deal with it, I will just go for it. So that's actually what is driving me since May, when we started the Cure Lab. And I'm really fortunate I've met incredible people so far, both in our community, but also different organization, mentoring program, people who have been actually taking some time to give us valuable advice on how we should go in the market and have a really positive impact. So thank you to them so far.
Okay, so, and then last question, what has surprised Steve most?
Oh, I think I would say probably.
I think they probably mean not in your whole life, admittedly. I think
Like, about the pandemic, yeah, I guess so.
Although feel free to answer it however you want to interpret it.
Yeah. To be honest, I've been living abroad for almost 10 years, and I really try to keep a connection with Africa by going there twice a year to be sure to follow the trends. And I think one of the key challenges we are facing right now is the connection with the local organization. And I was really surprised to see how sometimes difficult it was to get in contact with those organizations, even when you consider that you have a very small initiative that could be actually valuable for them in the way they're doing their current job. And I think that's really a challenge we have been having so far. So getting known, also having that traction from people we are really willing to work with, because we believe that they already have a good position on the ground, they have a good network, and they could be really we can really leverage them in order to have a bigger impact. So networking and having access to those local organizations is really a challenge we are facing right now.
And so Steve, I guess, final question, then we'll wrap up. If people on the webinar want to help you in solving that specific networking challenge, or they want to kind of join your WhatsApp channel, like, can you just kind of in the last minute explain how people can get in touch with you?
That's
what
amazing.
help for, like what you need.
Yeah.
And then we'll end on that note.
Perfect. So the first thing we need is actually to get people to find us. So go on Facebook, look for Accurate Lab, Stop Fake News. We have a Facebook page there. Follow the page, post on the page the different queries or news you would like to fact check, and our team will be there actually to support you. So this is much more the message for people on the ground. The second message is much more for local organization. We are always looking for content. We are always looking actually for recommendation from them in order to put it in a much more simple way to understand by people on the field. So reach out to us. We have a Facebook page. We have a website. I am on LinkedIn. So feel free to reach out. I'm really open, and I'm really happy to be discussing with you on all these different initiatives. So we want to get visible. We want to have the content to be sure to address the query of the user. And we want to be listening to the user in order to adjust the way we are providing factual information.
It's great. Thank you so much.
Thank you, Chelsea.
So grateful for all that you're doing. I hope that people will go to your Facebook page, will join your WhatsApp channel, will reach out to you kind of on every dimension that you talked about. I also just want to again thank Karen and Voices for Vaccine, Judy, and Unity Consortium, and Amy, kind of from Vaccinate Your Family. I mean, all that the four of you are doing is so critically important. While the kind of scientists race safely, but urgently, kind of toward a vaccine or vaccines, we all have to be doing our part to fight against vaccine misinformation and to kind of build public consensus and kind of public demand kind of for a vaccine when it does arrive, because ultimately that is our only way kind of forward and through COVID. And we won't be able to do that if we don't have people on the ground fighting against the infodemic. So just so much gratitude to Steve, Karen, Judy, Amy, to everyone at the CGIU team. Thank you, Maisha, for kind of kicking us off today and convening us. Thank you to everyone in the background, including Omar, who helps ensure that all this runs so smoothly. And thank you to all of you for joining us. Keep talking about vaccines, keep spreading good public health information, keep standing up against misinformation, and stay safe, everybody. Thank you so much.